Cutaneous leishmaniasis is a neglected tropical disease caused by the leishmania parasite and transmitted by an insect vector. It is present in more than 90 countries around the world and annually reports around 1.5 million cases. The cutaneous form of the disease is characterized by skin lesions that may be papules, nodules or ulcers. It can be treated systemically or locally. Currently, the World Health Organization accepts the use of thermotherapy as a therapeutic alternative for uncomplicated cases of the disease. The principle of the technique is the application of heat at 50 degrees centigrade directly on the lesion for 30 seconds. The advantages of using this treatment include a high safety profile, efficacy independent from the species, ease of use in the field, and the possibility of use in patients whose systemic treatment is contraindicated, including pregnant or lactating women. For application, the lesion should initially be cleaned to remove secretions or scabs. Then it must be evaluated to determine if the lesion is wet or dry. If it is dry, it should be wetted with a gauze impregnated with saline solution for about 10 to 15 minutes. After moistening the lesion, a local anaesthetic should be applied until the entire lesion is covered and up to at least 2 centimeters outside the induration or erythema area. The patient must deny sensitivity in the area in order to continue with the procedure. Thermomed is currently approved for thermotherapy application in cutaneous leishmaniasis lesions. Before starting, check that the battery is fully charged, program to operator mode, and set to 50 degrees centigrade. Also check that the electrodes are available. For leishmaniasis lesions, it is recommended to use a medium electrode. For correct application of thermotherapy, the area of affected skin, which includes ulceration, indurations and erythema, must be covered to ensure coverage of the entire affected area. A square or rectangular area should be simulated around the lesion. The number of applications needed depends on the area of the lesion and must cover all of it. Taking into account that the 50 degrees centigrade is reached only between the electrodes, so it is important that after the first application, the following applications should be made, setting it above the most distant electrode, as shown in the schema. It is extremely important to take into account that the electrodes must be completely over the lesion. Do not use the tips. The thermotherapy device has a built-in sound system that takes into account the phases of the process and is useful for the operator of the machine. First, there is a sound that increases in volume until it reaches the 50 degrees centigrade. Once this happens, an intermittent sound is heard during the 30 seconds of the application. To avoid possible infections, a local antibiotic has to be applied over the lesion for about 1 week. To finish the procedure, the lesion has to be covered with gauze and the patient has to be instructed in aftercare. Note that during the first week the lesion may be larger than at the beginning of the treatment due to inflammation caused by the heat. After the first week, the improvement to the lesion starts to show as it evolves into a scar.